Welcome to the Checking In podcast from the Great Lakes MHTTC, a series discussing topics related to health equity and the destigmatization of substance use disorder and mental illness.
So welcome Leonna Jackson to today's Checking In podcast. This podcast is dedicated to talk about self-care for clinicians working in the trauma field. Do you want to introduce yourself or talk a little bit about yourself?
Yeah, sure. So my name is Leonna Jackson. I am a licensed independent social worker in Ohio. I own a private practice where I also practice at. So I'm also a clinical therapist there. And then I have about 10 therapists that practice underneath me at my practice. It's called the Hearts Haven Center for Counseling.
Mm-hmm. And which word best describe the work that you do?
I would say clinical therapy is what describes the best what work I do.
Love it. What do you consider to be the most important aspect of your work as a trauma therapist?
So I think that the most important thing is meeting the client where they are at and tailoring therapy to the client is very much important, along with, building that relationship and rapport with the client, when you're working with trauma victims. And just making sure that you're delivering effective, meaningful therapy every session. So making sure that you're going into the counseling session, working on their goals and objectives that they need to meet. So every session counts.
Okay. And usually which population do you work with children, adults?
So I work mainly with adults. I do see some children, and the therapists at my practice do see children as well, but mainly adults. A lot of generalized anxiety, depression, and trauma work.
As a trauma therapist, can you share 3 challenges that you face that gets in the way of taking care of yourself?
Some of the barriers with taking care of yourself, sometimes the caseloads, can become a little bit heavier, or you can have someone who regresses. And so, they may be at, biweekly now and they regress, and, you have to put them back to weekly. And so you have to make sure that you have room for that and you can fit them in, to get them, the care that they need. And so sometimes that can be a lot on the therapist because it's, rearranging and figuring out how to maneuver your schedule to make sure everyone's getting what they need from their therapy. So that's one of the barriers, I think, kind of to that self-care. Sometimes your caseload can be a little bit heavier on some weeks. Another barrier to self-care, I think sometimes too, is juggling everything, the balance portion of it. Because, you're a therapist and you're dealing with a lot of things every day, a lot of heavy stuff. And so you also have your own family and your own issues and problems and, things like that too. So it's a huge balance of, the work that you do and then your own personal life as well.
And what are some effective self-care practices that you can share with other mental health providers that work with trauma survivors?
Vacations and staycations. So when I worked in community mental health before I owned my own practice, I took a vacation maybe once or twice a year. Now that I own my practice and I work primarily with trauma clients or the trauma population, I take a vacation or staycation. It can be 3 or 4 days, probably every 6 to 8 weeks, where it's 3-4 days, of not having any clients at all, not working at all, or a vacation every 2 months is a goal as well. You need a reset. Another thing is being mindful of your own personal well-being, physical and mental. So just being aware of what I need, and not neglecting that, because it can get, you can get really caught up in the work that you're doing and then you realize you're not drinking enough water and you haven't been to the gym and you're not eating correctly because you've eaten out 5 times this week because, it was more convenient with your schedule and things like that. So just being very mindful of your own mental health and physical well-being. And then one of the things I've learned as I've grown as a therapist is boundaries. When I worked in community mental health, the lines were very blurred sometimes, because depending on who your supervisor was, or depending on, I was young in the field, and people had different rules or different things that they, felt were, boundaries that should be set, or you can kind of bend this real kind of thing. So setting really firm boundaries for yourself, my phone goes off after 5 p.m. My voicemail says that, if this is an emergency, please call 911. Also the limits I have within my practice, we are not intensive, so if that person needs a higher level of care, we make sure that we do what is best for that client, setting those boundaries as well.
Well, I think that I love it because it's like prioritizing our health also, and taking time, right? Time off and rest. I think that's a great advice for other clinicians in the mental health field. So, is there some last words that you want to share with our audience today?
I think, you summed it up fairly well. Take care of yourself. You have to be able to take care of other people. You have to take care of yourself. You can't do the work that you do if you're not well, so.
I love it 100%. Thank you very much for being with us today.
Thank you for having me.
The Checking In podcast is produced by the Great Lakes Mental Health Technology Transfer Center with funding from cooperative agreements with SAMHSA. We encourage you to connect with the Great Lakes ATTC, MHTTC, and PTTC on Facebook, LinkedIn, and YouTube to discover many more free products and resources just like this.